What questions or problems are you working to solve?
Well, I've been curious about how pharmacists who provide comprehensive medication management impact the quadruple aim. So, comprehensive medication management, this is a service that pharmacists provide, and it's a process where pharmacists look to see if medications are indicated, effective for the disease that's being treated, safe. So they're looking at other medications and comorbidities of the patient, and best suited for the patient. So this would be looking at things like patient preference, cost, patient ability to take the medications. So this is a process that has been practiced for a while, and we have more and more studies on, the exact impacts of CMM. And so specifically, what I'm interested in is how the service impacts the quadruple aim. And so the quadruple aim has been adapted by many healthcare organizations. And what the quadruple aim is looking to do is to improve population health, improve the patient experience, decrease healthcare costs, and improve the care team work life. So we do have studies which demonstrate that CMM is positively impacting some of these components of the quadruple aim. So mainly population health, the patient experience, and leading to decreased healthcare costs. But we don't have as much research into how pharmacists providing CMM impact care team work life. And so this would be the members of the team that they're working with, their own work life. And so looking at, for instance, how when pharmacists are in a clinic, they're providing CMM, how they impact the primary care providers, how they impact the nurses, how they impact the staff at the clinic. And this is really important because work life has, we've understood more that work life impacts all these other components of the quadruple aim. And so, there's been a lot of talk about burnout, and we're more and more understanding burnout in healthcare, and especially in these days of COVID-19, burnout has become more of a problem. And we know that providers who are burned out the care that they provide to patients will be not as optimal. Burned out providers have the patients that they treat have increased healthcare costs and decreased healthcare outcomes, or not as optimal healthcare outcomes. And so, this specific component of the quadruple aim hasn't been studied as much, but I think is just as important as the other components of the quadruple aim.
Why have you chosen to pursue this question or problem?
So the way to optimize healthcare is really to pursue the quadruple aim. This is what many healthcare organizations are realizing. We can't really look at the individual components of the quadruple aim in silos. And so, for instance, we can't just look at improving patient outcomes without thinking about the other components of the quadruple aim, because they're all intertwined and they all depend on each other. And so I think previously in healthcare, we might have been so focused on improving patient outcomes that we weren't thinking about some of these things that impact patient outcomes too, things such as cost, provider work life, and the patient experience. And so, if one of these is not optimal, it's going to bring down all the rest of them. So as a clinician researcher, I see the impact that comprehensive medication management has on components of the quadruple aim. I see this in practice. But what I see is just my experience. And we really need rigorous research to really truly examine the impact and understand how pharmacists are impacting all these components of the quadruple aim. And I think more specifically, when we're looking at the impact of CMM, comprehensive medication management, on work life, we don't have as much information in this realm. And so, our initial research has demonstrated that when primary care providers are working with pharmacists, primary care providers see the pharmacist providing CMM as both a collaborative partner and as someone who has an added skill set and resource. So that collaborative partner component, the primary care providers described the pharmacist as someone who kind of had a shared journey with them. And this was important, and it was satisfying to the primary care providers. But not only did they have this shared journey, but they had a partner in the pharmacist who was providing things that they wouldn't necessarily do themselves, doing things more effectively and more efficiently for their patients, because the pharmacists were looking at things from a different perspective and from having that different skill set. So when they worked with this collaborative partner and this person that was an added skill set, this led, our initial research demonstrated that this led to improvements in components that impact work life. So it led to decreased workload for the primary care providers, some increased satisfaction that their patients are receiving better care. They had some reassurance. They said, just feel more comfortable that the pharmacist has looked over this. I feel like I'm doing things right from many perspectives. Some decreased mental exhaustion. And so they shared that, when I'm working with the pharmacist, I just have a load off my shoulders. I feel less mental exhaustion with complex patients, and more professional learning. And so the primary care providers shared that, working in this team with a pharmacist, they are learning about new medications, new approaches, ways to monitor the medications, and able to apply that to their other patients. And that's really satisfying. And among other outcomes, achievement of quality measures as well. And so this is something that primary care providers are kind of graded on or evaluated on within their clinics. And if they have help achieving those quality measures, that's really satisfying. And so I think that now, we're working on building on these initial findings. And so including nationwide surveys to look at how pharmacists providing comprehensive medication management impact the work life of the care providers that they're working with. So we have some of these initial studies, but we're really working to build on this information more.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
So as a society and as individuals, I think that we need to be open to healthcare change. It's happening. Healthcare change is happening in a lot of different ways. And healthcare is moving more towards supporting the concept of value-based care. And I think that this is really important in healthcare. Right now, we're in a healthcare world where we're looking more at fee for service, which means that people will come into appointments and their insurance company or them will pay for the service. We'll simply pay for the service that's provided. And it doesn't matter if the service that was provided really helped them to achieve their health outcomes, helped their patient experience, helped to lower costs, these components of the triple aim. The payment was just for the visit. And to support these changes in healthcare that are going to be beneficial and help us to help us to pursue the quadruple aim. Change will need to happen in healthcare. And I think also as a society and individuals, we can consider how team-based care, and so this would be team-based care in many ways, but maybe team-based care, including a pharmacist, can help you or can help a loved one. And so thinking about this and supporting this is going to help support this change that's happening. And all together, looking at value-based care, knowing that change is going to happen, supporting this, and even requesting team-based care for yourself or a loved one will help us grow in this area. And this will all help support the role of a pharmacist, which is, what my research is about, and help us understand kind of the details around how pharmacists impact the quadruple aim.